Colorado, like in most of the country, healthcare has become increasingly unaffordable. The inflation over the last 25 years, 121%. That's almost 40% more than just the cost of living inflation. In 2025, so this most recent year, the spend on healthcare is $5.7 trillion. And I think that when you look at that, it has really bad consequences. People make decisions. They can't afford their insurance. They can't afford their health care. They go into a hospital, get what they think is a simple procedure, and they come out impoverished. I think of it, people walking into a hospital blind and walking out impoverished. Right now, there are 100 million Americans, that's roughly 40% of the population, that have a total of $220 billion in debt, in medical debt. So these are people whose lives are being twisted and diminished because they've got the anxiety and the reality of insufficient health care. So I think the key is we don't know where the money's going. It's a completely blind system. Our bill lets patients know before they go in the hospital what it's going to cost. There are itemized receipts that's specified. Employers will have negotiating power. Again, if we think about it, there's 120 million people in America whose company pays for their health care. That company, and you can pick any company, let's say they have 40,000 employees, let's say they have 5,000 in Denver. They can't see what one hospital is charging versus what another is, what one scan costs versus what another scan costs. So that transparency will allow, in a very powerful way, those large employers to push prices down. Right, what we have right now is no one can see any of the prices, individuals, corporations, anybody. And what that means is not one industry is it a monopoly, but together they are what I've been calling an aggregated monopoly. The whole system is in a place where there's no price transparency. People don't know what the cost is. How are they going to lower the cost? You can't ever compete. So this bill puts real teeth into the penalties. I did an executive order when I was governor. President Trump did one in his first term, an executive order, as did President Biden. We've done executive orders. This will be the first time that we've actually had a piece of legislation with teeth in it that's going to make sure that this gets done. And if they aren't, there will be civil penalties for noncompliance. Hospitals won't be able to go out and collect debts if they are out of compliance. There are real serious penalties to all this. So, again, it's a corrupted, inefficient system that I think has been waiting for something like this bill.